In this video, I will cover the procedures of egg collection, fertilization, and embryo transfer. IVF refers to the medical procedure where the egg is fertilized by sperm outside the body, forming embryos, followed by transfer of the embryo back into the womb. We work as a team. Ultrasound examination, egg collection, and embryo transfer are supervised or performed by subspecialists in reproductive medicine on duty roster. The procedures in IVF include several steps: stimulation of ovaries, egg collection, sperm washing and fertilization of eggs, and embryo transfer. I will cover information on the egg collection procedure itself, pain relief during egg collection, prevention of pelvic infection, number of eggs aspirated, possible complications, and information that you need to know about admission and discharge from hospital. Egg collection. Egg collection is generally arranged 36 hours after the HCG or agonist injection. It is carried out in a treatment room next to the IVF laboratory. The process lasts about 10 to 15 minutes in most situations. The procedure of egg collection is shown here. It is performed transvaginally under ultrasound guidance. We cannot see the eggs with our eyes directly, but the needle here aspirates the follicular fluid, and the embryologist will then look for the eggs under the microscope. Pain relief during egg collection is a main concern for many women. In our center, egg collection is performed under conscious sedation, which includes an intravenous injection of painkiller and sedative, as well as a local painkiller given next to the neck of the womb. We do not perform egg collection under general anesthesia. With conscious sedation, the procedure is tolerated by most women with an average pain score of 40 out of 100 points. We try to prevent pelvic infection during invasive procedures. We generally administer antibiotics intravenously to prevent pelvic infection before the procedure. Please inform the team if you have any allergy to antibiotics. We also use antiseptic solution to cleanse the vagina before making any punctures. Next, I'll talk about the number of eggs aspirated. We can see follicles under the ultrasound, as shown in this photo. However, we cannot see the actual eggs with our eyes without a microscope. We can aspirate the follicles, but not every follicle aspirated has an egg in it. On average, around 70% of follicles contain eggs. Roughly 8 to 10 eggs are obtained per egg collection. This may be different for different women. And in poor responders, sometimes egg may not be obtained. There are some possible complications in the egg collection procedure. Because the egg collection is an invasive procedure that involves a puncture through the vagina to the ovaries using an aspiration needle, there are complications of intra-abdominal bleeding, pelvic infections, pelvic organ injury, and severe pain requiring hospitalization. In general, these complications are rare. Some important information regarding admission and discharge from the hospital. Do not eat or drink from 12 midnight the night before admission until after the operation. Bring your Hong Kong ID card and admission slip for admission. You have to stay in the ward for at least 4 hours after the egg collection. And discharge has to be with the company of an adult friend or relative. Next, I'll talk about the fertilization procedure, which includes sperm washing, fertilization methods, intracytoplasmic sperm injection, and the risks of ICSI. This diagram shows the procedure of sperm washing, the aim of which is to separate the motile sperm to be used for treatment from the immotile sperms. In here we can see the sperms before and after sperm washing. There are two insemination methods. The first method, the conventional method, is where the egg and the sperm are placed together in the culture medium, and the strongest sperm will then fertilize the egg. In intracytoplasmic sperm injection, or we call it ICSI, a single sperm is injected into an egg. It is important to note that not all the eggs collected will be fertilized. ICSI is only performed in case of severe male infertility. For other indications, it may actually lower the implantation rate. In a small proportion of cases, there may be no fertilization, and in these cases, our team will review the management. The eggs can burst after ICSI, and the babies conceived after ICSI have a slight increased risk of sex chromosome disorders compared to those conceived in conventional IVF. I will go through some information on embryo transfer. One question may be whether to go for fresh or frozen embryo transfer. In some situations, you may advise not to proceed with fresh embryo transfer and instead to freeze all the embryos for frozen embryo transfer later. There is no difference in success rate between fresh and frozen embryo transfer in women with normal response. A second question would be on embryo quality and blastocyst transfer. After insemination of the eggs, they will be assessed at different time points by our embryologist to see if they continue to develop. Day 2 to 3 embryos are called cleavage stage embryos, whereas day 5 and day 6 embryos are termed blastocysts. Embryo quality for day 2 embryos are assessed based on the number of cells and the degree of fragmentation. Grade 1 is the best, whereas grade 5 and 6 embryos are not transferred. For blastocysts, they can be graded into good quality blastocysts, fair blastocysts, or poor quality blastocysts. In general, the implantation rate and the live birth rates are higher if a good quality blastocyst is transferred. Extended culture of day 2 embryos to day 5 blastocysts can allow selection of better quality embryos for transfer, thereby shortening the time to pregnancy. On average, about 50% of day 2 embryos develop into blastocysts. So a small proportion of women may not have any blastocysts developing, and therefore no embryo for transfer. We have some protocols on the number of embryo or blastocysts to be replaced. The embryo formed is then transferred back into the womb using a catheter under transabdominal ultrasound guidance. Generally, we advise transferring only one embryo to reduce the risk of multiple pregnancies. The procedure of embryo transfer is Embryo transfer is performed under transabdominal guidance. Having a full bladder for the procedure allows us to visualize more clearly, and in some cases can straighten. These graphs shows our recent data on the ongoing pregnancy rate and live birth rates following fresh embryo transfer divided by women's age. As the woman's age increases, the ongoing pregnancy rate and live birth rate reduces. The reason why we want to avoid multiple pregnancies, even though we aim at transferring the embryo back into the womb, ectopic pregnancies can occur after embryo transfer. In these cases, the pregnancy is abnormal and further management may be needed. You can also download the photo of your embryo. You will receive instructions on how to download the photo of your embryo after the embryo transfer. Just follow the instructions. After embryo transfer in the fresh cycle, you will be given medications for luteal phase support. This is usually in the form of oral progesterone for 2 weeks after the embryo transfer to support the lining of the womb. There is no need to continue progesterone when pregnant. If you are pregnant after embryo transfer, we will arrange pelvic ultrasound when you are 6 weeks and 8 weeks pregnant to confirm that the pregnancy is ongoing and intrauterine. If all goes well, we'll refer you for antenatal care. This diagram illustrates nicely the timeline of IVF. In the ovarian stimulation phase, which takes an average of 10 to 12 days, daily FSH will be given to stimulate the ovaries. Antagonist will be added to prevent premature ovulation, and ultrasound monitoring of the follicles will be performed. When the follicles are large enough on ultrasound, HCG or agonist trigger will be administered, and egg collection will be arranged 36 hours later. After the eggs are being collected, they will be fertilized with the sperm to form embryos. 2 to 5 days later, the embryo is transferred back into the womb. Generally, we advise transferring 1 embryo each time. Pregnancy test is performed 14 days after embryo transfer. To summarize, around 70% of follicles that we see on ultrasound contain eggs, and around 8 to 10 eggs are aspirated in each IVF cycle. Of course, this is different for different women. In addition, not all the eggs will be fertilized. An average of 70% of eggs are fertilized, and not all of them would continue to develop as embryos. We advise replacing 1 embryo each time. The cumulative live birth rate after 1 IVF cycle is around 40 to 50%. IVF is also associated with possible complications, including multiple pregnancy, ovarian hyperstimulation syndrome, pelvic infection, bleeding, as well as increased congenital abnormalities of the fetus. I hope that from this presentation, you can also visit our website for more information. The link is shown in this slide. We also have Facebook and Instagram accounts, and you can visit our page for the latest information. Thank you for listening to this talk. If you have any questions, you can reach us as follows. The phone number is a voicemail most of the time. You can leave a message with your name, Hong Kong ID card, as well as contact number, and our nurse will get back to you.